Welcome back to Mountain Connections. Now, did you know that over 21 million Americans 12 years old and older live with a chronic skin condition that causes severe itching and inflammation? This is known as atopic dermatitis, which is the most severe form of eczema. Here to talk to us today is Dr. Sonia Batra to tell us more about this condition. Dr. Sonia, thanks so much for joining us this morning.
Kimberly, thank you so much for having me and for raising awareness.
So, tell us about atopic dermatitis. What is it and what are the symptoms?
So as you mentioned, atopic dermatitis is actually the most common form of eczema. And in addition to just causing itching, which is I think what everybody thinks of, it's actually a complex immune-mediated skin condition. And what that means is it causes itching, redness, scaly skin, often really dry skin. And it can affect different parts of the body, like the face, the folds of the neck, the inner elbows, the backs of the knees.
Can you explain what is happening beneath the skin with atopic dermatitis?
Absolutely. So what's happening beneath the surface of the skin is actually, like I mentioned, your immune system going into overdrive. And the reason that happens is because every organ in our body has a function. Like your heart is designed to pump. Your skin is designed to be a wall that keeps the outside world out. And in people with atopic dermatitis, the reason they feel dry all the time and all the water sort of evaporates from their skin is under a microscope, they have little cracks and fissures and openings in their skin that aren't meant to be there. And so people without atopic dermatitis or eczema are sealed and walled off from the bacteria, the viruses, the allergens, the irritants, all the things that are meant to be on the outside. But if you have atopic dermatitis, all those things can get in. And then when they're inside where they're not meant to be, your immune system goes into overdrive and starts really creating a lot of inflammation, which leads to itching, that redness, that dry, blotchy skin that can be so uncomfortable.
That really is very important information to be aware of. Now, what are some of the common challenges that patients face?
So some of the common challenges really are the itching because it can be so disruptive to life. I think that's the number one symptom across the board with atopic dermatitis. So people can be woken up from sleep. It can really impact their self-confidence. They may not want to go out into social interactions like to school or to work. And of course, when you have atopic dermatitis and it impacts your appearance, you can become so self-conscious, and that can really take a toll on self-esteem. But I think one of the other big challenges for people is really understanding the science so that they know how to have that conversation with their dermatologist. And that's why I'm partnering with Insight to really spread awareness so people can understand what's going on under the surface. Even if you have mild or moderate symptoms, it's great to go into your dermatologist and have that conversation before you flare, because it's so hard to set up a maintenance regimen that really fits a person's life if they're only coming in when things are really bad.
Well, that's really important information. Thank you for sharing that. Now, how can people best manage atopic dermatitis?
Well, no, thank you for helping me share it. I really appreciate it because this is National Eczema Awareness Month. And so in terms of managing atopic dermatitis, I think there are two components. One, like I said, is really having that informed conversation with your dermatologist, managing your symptoms when they're mild or moderate. We have a whole arsenal of anti-inflammatories that we can use more from the medical side. But then even at home, your habits make a big difference. So if you suffer from atopic dermatitis or even dry skin, remember it's really important to withdraw all those irritants I was mentioning. So fragrances, colors in the products you use, scent-free, dye-free, everything from laundry detergent, cleanser, moisturizer. Using that moisturizer to restore the seal is so important. And then really decreasing the temperature and the duration of your shower, because when you're dry and you have atopic dermatitis, it may feel great to stand under that long, hot shower, but counterintuitively, that's tremendously dehydrating and can make your symptoms worse.
Dr. Sonia, where can we go to find more information to remember all of these things that you've suggested?
Yeah, I know that's a lot of information, but there's a super helpful website. It's called startfromscratch.com. It has all this information about the science behind atopic dermatitis, ways that you can have an informed conversation with your dermatologist so that you can really start that management and prevention to prevent the flares.
Well, Dr. Sonia, thank you so much for joining us on this Friday morning. Love the play on words there for that website to learn more about atopic dermatitis. Now head over there if you have symptoms or you're wondering a little bit more about the disease. We'll be right back after this.